Adding fluoride to water has been called one of the greatest public health achievements of the 20th century. So why are we treating it like a public health threat in the 21st century? Some people say it's mass medication, others call it toxic waste. But the science is still strong, and the controversy is mostly political. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal. I'm a primary care physician in Connecticut, and I run my own medical practice. This video breaks down what fluoride actually does, why some cities are pulling the plug, and most importantly, who gets hurt when they do. When you strip away the political noise, this isn't just about dental care. This is about public health systems and the price of forgetting what once worked. Let's dive in. Fluoride's story as a public health tool actually started with a mystery. Back in the early 1900s, a young dentist named Frederick McKay was working in Colorado Springs when he noticed something odd. Many of his patients had brown stains on their teeth. Locals called it the Colorado brown stain. But here's the strange part. Despite this discoloration, these teeth were surprisingly resistant to cavities. That one observation kicked off decades of research, and it eventually led to one of the most important preventive tools in modern dentistry. In the 1930s, a dentist named Dr. H. Trenley Dean figured out what was causing the brown stains. It was fluoride in drinking water. He ran a study in 21 cities and found that when fluoride levels were just right, about 1 part per million, kids had way fewer cavities with only mild tooth staining. In 1945, Grand Rapids, Michigan became the first city in the US to adjust its fluoride content of its public water supply. Soon, other communities followed suit, including Newburgh and New York. These initial studies showed the relative risk reduction of 50 to 70% in dental caries among children and an absolute risk reduction of about 3 to 5 fewer decayed surfaces per child. Here's a common myth. People say community water fluoridation doesn't work because cavities dropped even in places that didn't add fluoride to water. That part's actually true, but it misses the bigger picture. Starting in the mid-1900s, cavities started declining almost everywhere. Why was that? That was because people started using fluoridated toothpaste. And they also had better dental hygiene and were brushing more often. They also had better diet with lower sugary foods and soda. And they were getting better dental care. But that doesn't mean water fluoridation stopped working. It just meant that the biggest impact was in lower income communities. Let's switch gears and look at some modern data on community water fluoridation. The Cochrane Library in 2015 published a systematic review to look at the evidence if fluoridation works. The Cochrane review found that there was about 35% relative risk reduction in decayed, missing, or filled primary teeth, and a similar 26% relative risk reduction in permanent teeth in people who lived in areas with community water fluoridation. Another more recent study out of England in 2023 found that there was a 17 to 28% reduction in dental caries in 5 years old and significant 56% reduction in dental extractions. There have been a number of studies that have shown that for every $1 invested in community water fluoridation, there's a substantial return on investment due to money saved in dental treatment costs. This slide shows one such study estimating the savings of about $16 to $18 in treatment costs. And this slide shows another study that estimates an approximate savings of about $32. Now, when economic analyses on public health campaigns such as community water fluoridation are done, there are generally several biases present. The study cited on this slide shows that when you account for estimating the cost of treatment of dental fluorosis, that is tooth staining, most of these savings might disappear. So what does all of this mean? The key takeaways are that community water fluoridation works and reduces dental caries. It does not require any action on the part of people and is a passive delivery mechanism. And as access to other fluoride-containing products has become available, the impact of community water fluoridation on dental caries is unevenly distributed, mostly along socioeconomic lines. Talking about socioeconomic determinants of health, let's look at how community water fluoridation impacts people in this population. This population includes people with low income and education, marginalized racial and ethnic groups, and those living in rural areas. Generally, these individuals have limited access to dental care and lower health literacy. These individual factors are in combination with each other may lead to poor dental hygiene. This then increases the risk and incidence of dental caries. If people have access to fluoride in community water, it leads to universal fluoride exposure throughout the entire community. This then leads to increased tooth enamel strength, which then decreases the risk and incidence of dental caries. So as you can see, community water fluoridation directly counteracts some of the detrimental effects of socioeconomic determinants of health. Now let's look at how commercial determinants of health affect dental health. Commercial entities, especially big sugar industry, target vulnerable populations to sell high sugar drinks, which drives dental caries. The same people also, because of their lower health literacy, fall prey to the anti-fluoridation interests, such as companies trying to sell water filters to remove fluoride. These commercial actors spread fear and doubt about the benefits of fluoride and may also directly or indirectly scare people about the harmful effects of water fluoridation by equating with industrial toxins. Most decisions about community water fluoridation are made either at the state or the local level. Both supporters like dental associations and public health agencies and opponents, including anti-fluoridation groups and sometimes commercial actors, lobby policymakers. Who gets heard often depends less on the strength of evidence than on the prevailing political winds, campaign contributions, and the vocal segment of the population that will be instrumental in winning elections. In today's environment of rapid misinformation, actors opposing community water fluoridation often frame this issue as mass medication or toxic waste to overemphasize harms. This erodes trust in public agencies and established science and can override decades of public health gains. An example of this happened in Calgary, Canada, where they removed community water fluoridation only to reinstate it after several years due to rising incidence of dental problems. Community water fluoridation reflects a societal commitment to preventive health, especially for vulnerable people. Removing fluoridation without any replacement will affect these communities the most, as structural conditions in which people live can make them more vulnerable to deceptive advertising and lack of access to dental care. Now, you might be wondering why we in the United States have to put fluoride in water when many other countries don't do this, or may have even banned this approach. Well, several other countries, instead of adding fluoride to water, actually add fluoride to salt, like Germany, Switzerland, France, and Mexico. Other countries, such as Eastern Europe and Asia, have school-based programs where kids are provided with fluoridated milk. And in some countries, such as UK, Canada, and Scandinavia, kids in schools receive fluoride varnish. What this really means is that countries without community water fluoridation use alternative methods of fluoridation, or they have a comprehensive dental care to catch dental caries early and treat them before it becomes a problem. Now, there are a couple of valid concerns about excessive fluoride. One of these concerns is called dental fluorosis, or staining of the teeth. There's a fair amount of evidence that the incidence of tooth staining due to excessive fluoride may have increased in the last few decades. This tooth staining is mostly harmless and is a cosmetic issue. Also, as mentioned earlier, the treatment for tooth staining is what wipes out most of the cost of savings of community water fluoridation. Furthermore, there are a couple of studies that show a link between children's IQ scores and maternal fluoride exposure. While there's plenty of methodology challenges on how to accurately measure maternal fluoride exposure, this does need to be studied further. As with any intervention, there are benefits and risks, and they may be unevenly distributed. We have sufficient data to demonstrate that community water fluoridation reduces the incidence of dental caries, which benefits some communities more than others at the expense of tooth staining and a low likelihood of a reduced IQ in children if total fluoride exposure is high during the prenatal period. We can have a genuine ethical debate about mass medication risk versus the benefits and the role of individual choice. However, it's also true that dismantling community water fluoridation without viable alternatives disproportionately burdens the vulnerable. You can find a written version with references to the material and audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.